So I started having contractions at 9 a.m. on the 23rd of April. I started going into labor, and it lasted until 7 a.m. the following day on the 24th. I was stuck at 9 centimeters dilated for 4 hours. When he was first born, he was not able to breathe on his own because he was stuck in my birth canal for so long, and it was terrifying.
Brooks had some issues after birth, and we found out if we wouldn't have been here with that one-on-one care and we'd have been in Green Bay, he likely would have been in the NICU.
Luckily, we had the telehealth NICU, and it was fantastic because I thought that he and Casey were gonna have to leave, and then I would have to be by myself and not with my brand new baby.
We would have been separated. So because we got that one-on-one care here, we were able to stay together as a family, which was really special.
At Door County Medical Center, we don't have a NICU, but that doesn't mean that we can't care for anything that can occur. We are prepared. Our nursing and pediatric teams are prepared for any complication that can arise in a newborn, and they can handle that with expert level with an additional force of that TeleNICU where we can have eyes on this baby and an advanced level of care immediately.
So a TeleNICU is essentially remote access to neonatal ICU services. So you have a secure line essentially for that support. And so it is not physically there, but you are able to access that knowledge remotely. In order to make sure that we're prepared for medical emergencies, or in case we maybe need an extra set of eyes or a little bit more confidence in that we're doing the right thing for the patient, TeleNICU here is maintained in order to have that extra security, that extra level of comfort in knowing that it's available, but not often needed to be utilized.
In that initial, what they call kind of newborn transition period, the first 3 to 4 hours of a newborn, they're doing a lot of work, and they're learning how to breathe, and they're learning how to feed and regulate their temperature. That those first 4 hours of life are critical in a newborn. And so if we can keep them here with the expertise and the knowledge of the neonatologists with the TeleNICU service, that might keep the mom and baby together here so they can get that one-on-one level care closer to home.
Currently, the nearest NICU is in Green Bay, and that is depending on the weather, and where the patient lives.
We don't have enough babies that need NICU service to be able to maintain that. But we're really lucky because we have a NICU relatively close by that we partner with, and we have really wonderful, dedicated, talented people that are able to essentially be in the room with us when we need them.
Our goal is to keep moms and babies together as much as possible. So we wouldn't want to have an infant sent to Green Bay and have them there and have the mom still, here at the other hospital, or for her to have to travel to Green Bay. So we never want to separate the moms and the babies.
The physicians and the nurses were so helpful. I was crying, bawling my eyes out because I was terrified, and they would keep coming in and saying, hey, we just want to let you know this is what's going on. Knowing that Door County Medical Center is able to handle these emergency situations with the telehealth, it makes me feel a lot more confident in coming back for if we decide to have another child, which is super exciting because we live right down the road from here, so we don't have to drive all the way to Green Bay just to give birth.